Good morning, everyone. I welcome you to our live presentation today. I hope everyone can hear me, and I pray that you are all doing well wherever we are with this difficult times of coronavirus. Um, I am waiting for one or two people to join that have specifically asked me to join. So I will start my presentation very soon, in about 2 minutes at 4 or 5 minutes past 10. But I hope I can see Lindy Wendaba. I can see Pauline. Thank you very much for joining us today. And the presentation today, I'm sure you will like it and you will benefit. It will be informative. I'll speak about a lot of information with regards to rehabilitation, with regards to some new treatments that we are now using in the medical field to help our children with special needs. So I believe you are going to benefit, and we are going to have more and more results as we try to incorporate the therapies to our families and all. So the presentation today is going to talk about more on children with special needs, but at the same time, the same treatments can be used to treat as well any neurological conditions that might be spinal cord injury, that might be stroke patients and all. So as we listen, some of the treatments apply to a lot of different conditions, and some of us or some of the people here have been have already listened to some of the presentations, and so after I will present, after the presentations, you can as well interact by questions and answers. So today I'll just present, then we will be asking questions and answers later. There is a chat box that is there. You can chat with us. You can highlight. If you cannot hear me, you can just let me know on the chat box that I can't hear you or I can't see you. Then I will see you with my settings. But so far, I believe everything is okay. Okay, it's now 5 past 10, so I can start. Thank you again for joining us. I'm representing STEM Med Rehabilitation and Integrative Therapy. Today, my name is Tapiwa Chitiyu, a neuropediatric occupational therapist in Johannesburg, in South Africa. So on this page, you will find we have our contact details in case you want to contact me and my team afterwards. So today we are going to talk about the importance of conventional and integrative therapies for autism, cerebral palsy, and other neurological conditions. So I will start by explaining that the world is changing, and it's changing very fast. There are revolutionary developments. Technology is moving very fast. Eating habits, food that we are eating, it's changing as each day passes, and dresses are changing. But there's a lot of things in the medical field that is changing, especially with treatments to neurological conditions, and that is leaving us as well with anxiety. The changes that are happening, some are good to our health, some are not good to our health, some are not good because they expose us to danger. Some they expose us to incurable conditions like cancers, some neurological conditions like autism, like cerebral palsy. And because of the fast changing of what is happening, the electricity, some people they talk about 5G, some people they talk about they talk about microwaves, and each and every day things are changing. Some people, they talk about GMOs with food, and the food that's where we consume as well. And when we consume the food that we eat, it ends up affecting our bodies as well. So those are the things that we are talking about today, and as well as how safe is the food that we are eating nowadays. Because of the shortages of the food, people have tend to genetically modified products so that they can have large production of food, chickens, eggs, fruits, and it's the same as, for example, the juice that we drink, we buy, that is written 100%. Is it real 100%? The dairy products that we are eating, the diets that we say gluten free, microwave, cell phones, all these things, it's advancement that is happening into our lives, and it's exposing us to different diseases that we don't even understand. Some of them we have no cure to them. Some of them we cannot control them, and it's affecting us. And today I'm going to present a treatment plan that is viable, that has proven to help children with special needs, that is holistic. Holistic meaning that it will cover everything from the head to toes, and it's individualized. The program that we are going to talk is going to be individualized in a way that we say one program cannot be implemented to another, but we can follow the same route because each and everyone has his own condition, and client centered. It will be client centered to a specific individuals. So on the first page, before anything else, that let's say, for example, it's a child with special needs. He might be having autism, he might be having cerebral palsy, he might be having any other neurological condition. The first thing is to do the diagnosis, which we call the mapping, to determine the treatment plan, whereby we achieve this through interviews and consultations. We do cognitive, physical functioning assessments through occupational therapists, speech therapists, and physiotherapists. There are scans that are done, which is a PET scan on the picture on my presentation. You will see that there is a PET scan, there are blood tests and DNA tests. All these tests are done so that we are able to determine the diagnosis of an individual. It's not like a long time ago where someone comes and we say they are not able to speak, and from there onwards we just say they need speech therapy, not knowing exactly what do they have. So right now, with the protocol that I'm going to present right now, it involves one to do the blood test, it involves one to do the DNA test, to specifically know if the condition is included in the DNA or is coming from the DNA. And at times we need to run the scans to see the brain, the portion of the brain that is affected, and as well as the functional assessments, which is through our therapies and individuals. So from there, we do a compilation of results, and a compilation of results that we get, and from there we can draw up a treatment plan and referrals. Then from there, the program in itself, it will involve someone to change their diet, because at times, depending on, because not everyone reacts to gluten as another. Not everyone reacts to meat, to beef, as to another person. So the diet is important, because everything that we are, the way I am today, it's because of the food that I eat. If I do not eat some nutritional components, I end up having malnutrition in a certain way, and I end up having symptoms in a certain way. So some of the conditions that we are having, it's because of the food that we are eating. And once we alter the food, so the DNA test, like I said, it will tell us what's the specific diet that the person is supposed to be eating, so that we follow that. And there are injections that can be done to supplement those nutritional elements that are lacking, and as well as referrals to necessary end therapies that I'm going to speak about. So usually with our diet that we recommend with at our organization, the STEMmed, we speak about the GFCF diet, which is the gluten-free and casein-free diet, because gluten has been evidence that it's a major cause of many conditions, especially to children with special needs, in a way that it increases their hyperactivity. It's got the potential to for the children not to be able to behave as they used to. It has proved to cause inflammation into the brain or into the cells, because gluten and casein, they are gluten is a sugar that is found in wheat, and casein is a sugar that is found in dairy products like lactose. So generally our bodies cannot break down that sugar easily, and it ends up being stored for a long time in our brain or in our cells. At the end of the day, where there is more sugar, there is water flows out. So at the end of the day, you end up being dehydrated. The cells are dehydrated. They don't have adequate water enough, and and at the same time they react. They react by causing inflammation to the cells. So they show to have side effects, especially to children with special needs, that they end up not knowing or not being able to communicate that they need water. They feel like they are dehydrated, they have a headache or something. So gluten-free and casein-free diet is important in whatever that I'm going to talk about, and as well as exercises, nutritional supplements will be beneficial. So when to start? So usually, like I said, when do you start? Let's say, for example, we already have a child with special needs. The initial stage is to do the assessments, like I told you, the blood tests, the scans, the DNA tests, to determine what exactly is the specific diet the individual is supposed to eat. And from there, we will help you to determine the diet that the person is supposed to be eating, and as well as the supplements that each and everyone is supposed to be taking. So the other treatment that I'm going to talk about is that we do at our organization is regenerative medicine with the use of stem cells. Stem cells is they are specialized cells which can multiply and multiply numerously, and can convert to any type of tissue or body, with the ability to reach out and repair damaged body parts. So these are primitive cells. These are first cells of life that when a baby is formed, you will find out that they are the ones who are responsible to make the head, the eyes. The way I look, I came from one cell, and from that cell, there was multiplication of cells, and from multiplication of cells, there is specialization of cells to form the head, the eyes, the hands, but everything came from one cell. Those are stem cells. So with our protocol in our organization, I'll present to you Dr. Bian Stander. He is one of the doctors that work with us, and he is a regenerative medicine specialist who work with us here in Johannesburg, in South Africa, with this protocol. So I will first present like the stem cell therapy as it is. We talked about the therapies after regenerative medicine. So you will find out that the stem cell therapy, it forms part of the pillar of regenerative medicine, and our specialist, Dr. Bian Stander, is the one who does the procedure. So I'll speak about, a little bit about his procedure. One day he will present by himself the procedure, how he does it, and how it goes in the theater. But I'll just present in passing so that I can go to the therapies that we do. So, like I was saying, the stem cell therapy, these are the first cells, as we can see in the middle here, and these cells can convert to any cell. They can convert to muscle, they can convert to fat cells, they can convert to cartilage, they can convert to heart muscle, they can convert to nerve cell, blood cells. So these are the first cells that formed a human being. So these are the four cells that formed the head, the ears, and everything. So they can differentiate to any muscle, to any tissue. They can reduce inflammation. They can fight cellular death, and as well as they have the ability to repair, to replace, and to regenerate any cell in the body. So let's say, for example, someone is injured or something. These stem cells, by properly applying them to that affected area, they can be able to repair, to replace, and to regenerate. Please, if you cannot hear me, there is a chat box. You can just chat with me, highlight, so that I can adjust my settings here to see if everything is okay. All right. So the stem cells have the ability to produce positive chemicals. These positive chemicals, they are the ones that are able to reduce the inflammation. They have the potential to maximize cellular development. When we talk about regenerative medicine, they produce positive effects to cells so that they can multiply, they can function optimally. So the stem cells have the ability to do that. They have the ability to produce more mature network veins. So let's say, for example, one of the problems with our children with special needs, as we have the results that we have, it shows that most of the children with special needs, especially autism, they have less bloody veins that is supplying their brain. So you find out that because of that, there is lack of oxygen going to the brain. Because of that, they end up getting tired easily. They have less attention because there is no oxygen, or the oxygen that is going to the brain is reduced. They easily get tired. Their attention is not as adequate because oxygen is less. So oxygen supply is important. So what supplies the oxygen to the brain are bloody veins, the capillaries. So the stem cells have an ability to increase these bloody veins so that there is more supply of oxygen to the brain. The stem cells can do that. They can do that. So there are different types of stem cells. I'm sure some of you will research, you will come across embryonic stem cells. These are stem cells that come from the embryos, and we don't use those cells because they have proved to be a little bit of carcinogenic, and they have. When I say carcinogenic, they have proved to show that they might be cancerous, and as well, they have ethical issues because usually they use unborn fetus to get embryonic stem cells, and ethically it has been banned, or the research has been reduced because of that. They are what are called umbilical cord stem cells. Those are stem cells that are taken from when a child is born. You cut the umbilical cord, and you take stem cells from that, and from those stem cells we have to bank them somewhere else. And the umbilical cord itself, it has to remember, let's say, for example, a child is born today, and we realize that a child has got autism at the age of 3. And some of us, we didn't even did the banking of the umbilical cord. The major problem is this umbilical cord has to be stored. The process of storage can alter the stem cells, their shape and their function. And with our protocol, we do not advise, or we do not use more of these cells. And again, I'll talk about the adult stem cells. These are the stem cells that we are using right now, which come from the bone, the hip bone, the bone marrow. So inside the bone, there is what is called the bone marrow, and the bone marrow contains these cells, the adult cells, which we call bone marrow stem cells, that as well can be used. These are safe because we take the stem cells from the same individual. We take the same from the same individual, so we only take them and we separate them, and we inject back. So these stem cells, they have no rejection because they are coming from the same individual, and they are easily obtainable because it's just an injection. They have no ethical issues, and they have proved to be not cancerous, and they are safe. So these are adult stem cells, the ones that I said, the bone marrow stem cells, which are safe to use with our protocol. So this treatment that I'm talking about, it can help in many conditions, neurological conditions. It can help with autism, cerebral palsy, spinal cord injuries, multiple sclerosis, muscular dystrophy, intellectual disability, dementia, stroke, Parkinsonism, and many other neurological conditions can be helped with this protocol that I'm explaining. There are orthopedic conditions as well. Let's say, for example, someone has arthritis, which is neck, back, knees, hip arthritis, knee problems, sports injuries, rheumatoid arthritis. All these conditions can be helped with stem cells, the stem cell therapy, the protocol that Dr. Vian is doing with StemMed. And we have as well systemic conditions, which is diabetes can improve with stem cells, and myocardial infarctions. These are heart problems. Like I told you, the stem cells can integrate into any muscle. They can improve as well the heart conditions, asthma, lung conditions. They can be improved with stem cells. But today, I'm focusing more on neurological conditions, dealing with children with special needs and spinal cord injuries and all. And so the process, it involves the taking of the stem cells from the bone, which is the bone marrow aspiration. The process is done in the theater, and the patient or the person has to be sedated with anesthetist. Then from there, we draw from the bone marrow the hip bone, which is the largest bone of the body. Then we take them to the laboratory. From the laboratory, the cells are separated. From separation, then we take the pure stem cells. They are counted to know the amount of stem cells that we are going to inject into the body. Then from there, once we know we have adequate amount, then we go back to inject to the patient. So there is Dr. Vian in the theater, whereby they're in blue. So he is here, he's harnessing the stem cell, which is the first process of the bone marrow aspiration. He's taking the stem cells from the pelvic bone, and the other picture is clearly showing you how the process is done. So you have to get into the bone so that you can get the bone marrow, and you get the bone marrow out. Then this is the second process, whereby we have the stem cells. We now separate, because they'll be mixed with other cells. So we separate them and into the laboratory so that we can have pure stem cells. They have to be living cells, pure cells, cells that are living, that are continuously dividing as each time passing. So from there, even in the laboratory, the stem cells under a microscope, you can actually see them multiplying and as well as dividing. This is the third procedure, where the child sleeps, and from there we inject back into the spinal cord, because we believe that the spinal cord and the brain, it's one system. They're enclosed with a sheath. That sheath as well, inside the sheath, there is what is called cerebrospinal fluid. So the stem cells, they are injected into the cerebrospinal fluid so that they can travel around the spinal cord and the brain, and as well as start their repairing. So if the problem is coming from the spinal cord, then the stem cells will be indicated to go to the affected area or to the brain. So most of our children with autism and cerebral palsy, their issues is with the brain usually, and the brain is the stem cells will go directly to the brain. So we do another, whereby our stem cells, when we harness the stem cells, instead, let's say, for example, someone has a systemic problem, they have a heart problem, they have a kidney problem, we inject now into the blood. So let's say it might be a child with autism, and their brain has been affected. So we might do the intrathecal injection, whereby we inject through the spinal cord, but they might as well have a kidney problem. When we do the blood, we know that the child is having a kidney problem. So by injecting into their blood, we can be able to as well help with that. So we can help with systemic problems and organs problem. Then at times we inject locally. Let's say, for example, a child was playing, or it's someone who plays football and they injured their knees. So we inject directly into the knees, thereby aiding the regeneration of the cartilage of the joint formation, so that the joint can come back to its normality. If it's the tendon that has been affected as well, the stem cells can repair. So that's why I said it's holistic. Let's say, for example, a child has got problems with the brain, but at the same time a problem with the kidney, and at the same time he fell off and he injured his knee or any other joint. So we can as well use stem cells for that, and as well as what is called the platelet-rich plasma, which is PRP. We inject as well into the bones so that we can aid the regeneration. And so from there, after the procedure, so that's only the procedure. The procedure takes about 1 to 2 hours, 3 hours, and the procedure is done. 45 minutes of taking out the stem cells, 1 hour of separation, and again 45 minutes or 30 minutes of injection into the patient. These two procedures, they are done in the theater, and so afterwards, the person will get into the recovery stage where they will be, they might have slight headaches now, and in where the injected part was injected. So we give them as well stop pains, and as well as antibiotic, so that the antibiotic, so that they don't get infected. This is an example of a PET scan. Usually, we learned this technique from Neurogen Brain and Spine Institute, where the PET scan can actually prove that stem cell or regenerative medicine works, because this was a scan on top. The first line where there are blue parts, it's this was from a child with autism before the cells on the first pictures, and then 6 months after the stem cells, you can clearly see that the blue part has washed away, or it's going away slowly, and it's a progressive improvement. As each time passes, there is continuous improvements to the. So the stem cell protocol is done at Bishmet here in Kenton Park in Johannesburg in South Africa. So if you want, we will be doing here where it's a day clinic where our patients come. We have our reception and our rooms, the recovery rooms, and our theater at Bishmet. These are our rooms. That's the team that we usually work with. That's Dr. Vian Stander and his theater team. They help us to do the treatments. And I'm getting now into the topic of today, which is the therapies after that procedure of the stem cells. Because remember, the living cells, those stem cells have been injected now into our bodies, into the brain, to repair the brain, or into the joint that was affected, or they're into the bloodstream. Now they are moving up and about. So the therapies that are important so that you can gain recovery, because why we are saying therapies is to re-educate or to educate the new cells, the new developed cells, the cells that have regenerated. So those cells as well, they need to be educated. So the type of education, how do you educate them? How do you support their survival? Because since they are living, they need to survive. They need a supporting system so that they can survive into our bodies. So there are various. Some of the therapies here are not have not been written here, but there are a lot of doctors, there are a lot of therapists who are working tirelessly in this field. So we have the occupational therapy, physiotherapy, speech therapy, psychology, special education, the diet, prolotherapy, IV injections, reflexology and massage, hyperbaric oxygen therapy, ozone therapy, magnetic stimulation therapy, low light laser therapy. So these are the therapies that I'm going to present as well in this presentation, to see how do they help with our children with special needs after the treatments, or even before the treatments it is necessary to do. I will start with the hyperbaric oxygen therapy. These therapies we are doing here, you'd find out that that's our machine, the hyperbaric in blue, and we have the ozone chamber. So all these treatments, all these machines, they are there. I would want maybe some to research on the hyperbaric oxygen therapy. It's a therapy. It's a technique that is being used to supplement oxygen into the brain, into the body. Specifically because we know, like I told you, that children with special needs, they have proven that they have less blood flow into their brain, and because they have less veins, the vascularity of the brain is less. So because of that, there is less oxygen going into the brain, and because of that, we would want to supplement oxygen. And how do you supplement oxygen? Because it's air that we breathe with our nose, and you want that air to be inside our veins, and that has to go through the lungs. So these machines, the first machine that in blue, it compresses oxygen. It's compressed pressure. So an individual gets inside that blue chamber, and the pressure that is there, it raises up to the maximum is 3 atmospheric pressure, but we usually use 1.3 to 1.5 atmospheric pressure, which is normal, and which helps us not to reach the oxygen toxicity. So what happens with these machines is uh, oxygen in our bodies is transported through hemoglobin with the red blood cells, and as well as plasma. So the hemoglobin carries 95%. So there is what is called the oximeter. You in the hospital, I'm sure some of you have been in a hospital where they put an oximeter on your finger, and it starts beeping, ding, 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 and it records 96%, 98%, 95%. That's the saturation, oxygen saturation of hemoglobin, which usually reaches 95%. But we have plasma as well. Plasma, these are other cells as well that carries oxygen, and usually it carries 1.2% of the oxygen, total oxygen. And usually when we breathe, the air that we breathe has got mixed gases, and these gases, oxygen only is 21%. But here with these machines that I'm talking about, it will be pure 100% oxygen, and as well as pressurized so that you can breathe this oxygen. It will be 100% and 100% oxygen, and not 21%. And this will force the oxygen to get into the hemoglobin and plasma. At the end of the day, you end up having 100% of oxygen in the hemoglobin and 100% in the plasma. This will increase as well oxygen getting into our tissues, oxygen getting into our affected area. Let's say, for example, it's a brain area that there are no veins going through there. So when we increase oxygen, it revives the cells. The cells, they come to life with hyperbaric oxygen therapy. So as well, after stem cell therapy, let's say, for example, you don't have enough oxygen in the brain, those stem cells, they will die because we inject them into the spinal cord, into the brain. So they will not survive, because for them to survive, they need oxygen. So with oxygen supplementation, it prolongs their lives. The lifespan of the stem cells, it will increase, and as well as the activity of the cells of the brain will increase, thereby increasing the regeneration of other cells, and increasing function of the cells. And then the way it functions as well is it increases the immunity of our bodies, because the neutrophils, they function by releasing some superoxides and peroxides, and these oxides, there is need for oxygen. So with oxygen, when you use the hyperbaric oxygen, there is an increase of these superoxides, and thereby increasing the immunity of an individual. And at the same time, bacteria, it suppresses multiplication of bacteria, because bacteria does not like oxygen. Bacteria like streptococci, it doesn't like oxygen. So when you supply oxygen, you limit the survival of streptococci. And with regenerative medicine, we want someone to be as healthy as a horse, so that you don't have any, because stem cells, if you are sick, stem cells will go to those areas where they are affected, and they start curing that problem. So instead of healing your brain, they'll be dealing with other things. And as well as they enhance fibroblast function, which is, let's say, for example, wound healing. They oxygen chambers or hyperbaric oxygen, it increases wound healing, and as well as it reduces inflammation of the cells, because inflammation is when the cells are trying to heal themselves. They are trying to heal, and they activate the inflammation process. So if it's a prolonged inflammation because they want to heal, it ends up affecting ourselves as well. So the oxygen chamber, it enables, it reduces inflammation. I will talk about the magnetic stimulation bed. So the magnetic stimulation bed is like, this bed. It releases electrical impulses. The patient sleeps on top. We turn it on, so it has magnets that will be moving up and down of the spine. So as they move up and down the spine, they are turned on, and they start releasing electrical magnetic impulses. So with electrical magnetic impulses, they aid uh, uh, they aid they help the cells with, there is what we call cellular signaling. And cellular signaling, it depends on ions, it depends on some chemicals. And these chemicals, when they enter into a magnetic field, when the magnetic field enters, they quicken that process, thereby enhancing the cellular signaling, enhancing the nerve function, enhancing the brain function. Because usually our children with special needs, they're a little bit slow, because the synapses, the cell to cell synapse, is when one neuron comes and wants to give another neuron information. It's like this. So this space is maintained by chemicals. So the magnetic stimulation, it stimulates this joint, so that there is communication between cells. So that's what we call cell signaling. So it enables the brain to function very well. At the end of the day, the child can memorize, the child can do activities quickly. There are children that you tell him, go and do this thing, go and put this in the kitchen, go and put this in the bedroom, go and take this. It will take him 30 minutes, 10 minutes, 15 minutes for him to react to the response, because usually the cell signaling is very slow. But with magnetic stimulation, it increases the cell signaling, so that information is passed rapidly, and there is a quick response. So we say that there is you give an impulse, and that impulse, there is a reaction afterwards immediately, because the information is passed from the hands to the brain, and from the brain to the hands quickly. There is no delay. And I'll talk about as well the low light laser therapy. Laser therapy, which is called photobiomodulation, is the use of light to stimulate the cells. We know that light is can penetrate. The laser can penetrate the skin, can penetrate the bone. It can get into the cells depending on what light are we using. There is a red light, which is the infrared light. There is yellow light. There is blue light. Some they are using it for. So it depends on the penetration that you need. You can use different lights. So this therapy, we use it because it's invasive. You don't need to cut to stimulate the cells. Once you expose a child to this light, so it can be any area, it can be a joint that you need more activity. Once you turn on that light, you put the gadget on the affected area. It might be the head, might it be the joint. Then the light penetrates and stimulates the cells. By stimulates the cells, it strengthens the mitochondria. The mitochondria, then the mitochondria, we call it the energy house of the cells, whereby they strengthen and they start producing energy adequately in a way that the child will continuously because children with low attention span, they end up becoming attentive to detail, and the cells have been stimulated directly, and they can now function better. So we talked about the hyperbaric oxygen therapy. We talked about the magnetic stimulation. We are talking about the light therapy. Actually, the development of the light therapy, it came from the sun. Let's say, for example, I sit in the sun for 1 hour every day. You'd find out that yes, I get vitamin D, but if it's too much, you end up getting darker, you end up getting acne, you end up getting skin problems, because the light affects our cells directly. The light can affect. So that's where scientists came with this technology of laser light, where the sun actually can change the reaction of the cells. So here, this light is penetrating into the cells, into the bone, into the cells, into the brain, thereby stimulating cells and to get positive results. So there are some of the things that I'll talk about with regards to supplements. So here I just put some of the supplementation. So let's say, for example, you have done your stem cells, you have done the regenerative treatments, you are doing your oxygen therapy. You're doing your oxygen therapy, and you have more oxygen into your brain. You are doing the magnetic stimulation, you have stimulated your synapses and all, and you have done the laser treatment. Now what you eat now can actually make the stem cells to die, or can actually make reduce the process of regeneration. So we are talking of there are some supplements like vitamin D3, which strengthens the bones, the muscles, and as well as boost immunity. This time of COVID, people were using as well vitamin D3 to boost the immunity, and to boost the immunity, and as well as to aid weight loss and all. So you'd find out that the vitamin D3 is crucial for the absorption as well of calcium, magnesium, and phosphates. That's why they help with strengthening of muscles and bones. There is omega 3. Omega 3 is important as well for brain health, for neuronal development, for our neurons. They help very much, and they help reduce symptoms of ADHD. And they are the omega 3 fatty acids, which is fish oil. They are anti-inflammatory. And we will talk about vitamin B, complex B. Uh, um, these are joint vitamin Bs that help with cellular growth and good eyesight, healthy brain function. These are the supplements that we always recommend people to take, especially the omega 3, as it is anti-inflammatory. It has anti-inflammatory agent that as well helps with our children to calm down the flames in the brain, and as well as so these supplements, they are recommended as well, because you can never know the amount of light. You can never know the amount of light that you are getting. You can never know the amount of inflammation that is in your brain, and as well as you can never know the amount of complex Bs that you are taking, the vitamin Bs that you are taking. So basically, the supplementation after the regenerative medicine procedure is necessary, and I usually recommend as well to any other, some of our children. You can never know if they're getting adequate sunlight. You can never know if they're eating enough eggs from vitamin D3. So, but with our children with special needs, we want to see results. We would better supplement vitamin D3 so that their bone structure is on point, and their muscles. Children with cerebral palsy, with arthritis and all, their muscles are weaker, and they are flaccid. So we can use as well supplement vitamin D3 so that their muscles can gain their dexterity and muscle strength. So these supplements, there are a lot of supplements that we can use that we recommend depending on the condition. Usually we run blood tests. Dr. Vian would recommend you to do the blood tests to see the amount of the level of vitamin D that you have, the amounts of vitamin D3, vitamin B12 that you have. Usually, if you have lesser, we will supplement. But usually, generally, with our children, we recommend to take vitamin D3, the omega 3, and complex B. Usually, with omega 3, with oils, scientists as well recommend that our children should eat more of fish, fish at least 3 times a week. We should eat fish. So by eating fish as well, you are having omega 3, and as well as to use less sunflower oil as it contains make omega 6. Omega 6 is not really advisable and for neurological conditions and all, but we recommend omega 3. Okay, then I'll talk about the CBD oils. A lot of people they ask about CBD oil, the function of CBD oils and all. This is over about there are over about 100 chemical compounds known as cannabinoids found in cannabis or marijuana. So there are strains of included in marijuana. So some people, when they take the marijuana plant, they might want to sleep. Some they get euphoric, they get hyperactive. Some they get appetite. Some they so those are strains that are acting on different bodies. Some they get relaxed. Some they get so scientists when they went into the laboratory they separated those strains in the marijuana and came out with those different type of strains. So usually when you're buying your CBD oil, you have to check which strain are you taking and if there is availability of different strains, because with CBD oils there are different type of strains. And as well there is inside the marijuana plant there is what is called THC. The THC is the one that is addictive, is the one that is psychoactive, is the one that someone gets high with. So with CBD oils, the scientists take out the THC to remain with the CBD oil, the different type of strains, in a way that my child is not sleeping well, and they take one strand of CBD oil that makes relaxation and as well as that activates sleep, and the child might sleep. And there is some that act as an analgesic. They reduce pain, they reduce anxiety. To most of our children with autism, they are too anxious. That's why they end up becoming hyperactive. They do not aware of, or they don't feel safe. Usually they have this anxiety issues. So with CBD oil as well, CBD oils have proved to improve with anxiety. They've proved to as well. There are children with epilepsy, with seizures. CBD oils, they have proved there are strengths. So I'm saying, so depending on the brands, like the supplementation, like I've been talking about this supplementation, there are different types of, for example, vitamin D3. Here I've put Solal as a product. It's just an example, but there is Biogen, there is Solgar, and there are different types of brands. The same with CBD oils. There are different brands, different. So one has to do his homework. Like this CBD oil, where is it coming from? Is the company legit enough to produce this, and what is the process of production of this CBD oil that I'm going to use, and all. And this THC as well is now being sold separately, which as well to those people who wants to get relaxed and all, and as well as it works to relieve pain. But like I said, the CBD oils, we recommend to use CBD oils as it has these components, different components of someone relaxed, and which helps with regenerative medicine. Because when someone is anxious, too anxious, or if someone is too depressed, depressive mood, you end up producing hormones that as well activate cell apoptosis, cell death as well. So you regress. So we don't want that. So, and as well as seizures, there are children with epilepsy. We want the seizures to reduce so that we can gain function. So CBD oils as well have proven to reduce seizures, amount of seizures, but has to be used as well with anticonvulsants so that you don't leave your medication that you're taking. CBD oils is just a supplement, like I'm saying, it's a supplement. It helps, but when you're taking your, let's say, for example, your epilepsy medication, you have to take along with, and you don't need to leave your medication saying I'm taking CBD as it is a supplement. It's just like someone who's taking vitamin D3 as a supplement. It doesn't. You don't need to say I'm no longer eating eggs because I'm eating I'm taking supplements for vitamin D3. I'm no longer going to eat fish because I'm taking omega 3s. So you can take, you continue taking your food, you continue taking your diet, you continue with your diet. This is just a supplement that helps the body to respond adequately to the treatments that we are doing. And I'll talk about, so I've spoken about hyperbaric oxygen therapy, I've spoken about magnetic stimulation, I've spoken about laser treatments, I've spoken about supplementation, I've spoken about CBD oils. Now I'll talk about occupational therapy. So occupational therapy is the use of whatever you have, the environment, the toys, whatever, so that we can maximize the independence. So let's say, for example, a child, the regeneration, the stem cells have been done already. You are exposed to oxygen therapy, you are exposed to all the machines, the magnets, you are taking the CBD oil, and regeneration in the brain has already started. Your brain is now your brain has now recovered or is recovering. There is no inflammation. If you don't teach the child, if you don't teach the cells something, what to do, they remain like that. So let's say, for example, we have now a cup that is empty. And that cup, if you don't put water in the cup, it will remain empty. If you don't educate the brain, it will remain empty. It's just like someone who grew up in the rural areas. We have never seen a traffic light, we have never seen a microwave, we have never seen a car. You take them into the city, they will not be able to know anything because they have never been exposed to those things. So exposure is necessary. So with our children, why we expose them to occupational therapy is because they are already delayed. We are delayed in our with time. Imagine it's a child who is chronologically by years, he is 12 years already, but in the brain he acts like a 2-year-old child. So that gap that is there, we need to close it with therapy. So therapy is maximum attention to detail. We expose a child to this stimulation so that we can bridge the gap that is existing. So occupational therapy will maximize independence, the same as special education. So we call it special education because it will be individualized. It's a different setup whereby a child is in a normal mainstream, is in a classroom with a normal teaching methods. Here, special education, it involves techniques like ABA therapy, applied behavioral therapy. It involves techniques like sunrise. It involves techniques, a lot of techniques that you can use, but it falls under that special education. You are teaching an individual with different models, techniques, so that they can grab quickly. So with our children, we end up using toys, colorful things. We call it audio visual stimulation so that they can grab more information. If it's ABCs, if it's colors, we end up using toys. And as well as we edge individual attention, whereby our team will be attending to you individually. individually and not in a more of a group setup. We can as well expose our children to group setups, but so usually I'm talking about special education, I'm talking about occupational therapy, which is important. So with our children with special needs, the same thing with stroke and spinal cord injury. For you to go back to your level of functioning, you need to practice activities of daily living. You need to go back to bath yourself, to wash yourself. You need to be exposed to these activities and not someone to do it for you. You yourself to do it yourself, expose yourself to the environment. So by so doing, you need specialized therapies, which is occupational therapy, which is physiotherapy, which is speech therapy, which helps you to speak with different types of techniques so that you can speak, you can function adequately in your given environment. These are some of the techniques that we do at our center, where our children are exposed to writing. In a special education, we use puzzles so that we can stimulate their attention, we can stimulate the regenerated cells, and as well as we expose them to group therapies, we expose them to activities of daily living whereby the child has to brush himself his teeth, rather than the daily routine whereby we know that our child is a special needs child, and we usually brush his teeth, we usually bath him. Here we are talking of the child doing himself. So we are educating the child. At the same time, physiotherapy, they have to be involved in physical activity, physical stimulation, so that they can, and as well as socialization, because most of our children with autism, they have problems with socialization. They like what is called solitary play. And here we are talking about group play, where we can stimulate their socialization. This is our center, which we call SACAT Center, which is South African Child and Adult Development Therapeutic and Learning Center, that is working with STEM med rehabilitation to realize all these therapies that I've been mentioning. This is the same center. This is our rooms that our children sleep and do their therapy. So it's a care center that is working with a rehabilitation center, the STEM med rehabilitation center, and these are our rooms that we function at a center. So all this that I've talked about, it's to improve the people's quality of life. So no matter where you are in America, in Africa, in Europe, the same techniques can work. We are doing it here in Johannesburg. We are doing it here in South Africa. Like I told you, it's medical consultations, it's stem cell therapy, regenerative medicine. It's your diet that is important. It's supplementation that is important. It's therapies. It's everything together, joined together to get the adequate results. It's education, special education, speech therapy, and all. And here comes to the end of my presentation, which we call the HIC approach, the holistic, individualized, client-centered approach. This is what we do at STEM Med, and my name is Tapiwa, and these are our contact details. Thank you very much. And you can take a picture, you can take a screenshot, you can take our numbers from there. There are emails that are there, and as well as on this webinar, there is a link where you can give your comments, what you think, and what you think, what's your recommendations that we can talk about on our next presentation. I'm sure our next presentation is on next week Wednesday, but we will post information. So we are trying to do these presentations frequently so that people might learn, because a lot of people, they don't know what to do. I have a child with special needs, so what do I do? So we are doing this, we will do this extensively every week. So some of the people that have missed this presentation, they can as well watch on the next program, and as well as we will continuously do them. And this presentation, we will upload it on YouTube. We will send you the link. We will send you the recording so that as well you can benefit. And all. If you have any questions, any recommendations, I urge you to send us an email, send us a message on those following numbers, and we will be ready to talk to talk about whatever your concerns. If you want help, you want stem cells with our doctor, stem cell therapy with our doctor, Dr. Bian Stander, you get in touch with those numbers. You want to learn more, you want us to help you with your center, you want our therapies that we are doing at STEMmed, you can come and we can help you with that. Thank you very much. And this marks my end of my presentation, which is exactly 1 hour. I thank you. Thank you, Lindiwe. Thank you, Lorraine. Thank you, Pauline. Thank you, Luke, Jasmine, Andaline, Cherie, and Ketiwe. Thank you very much. And I hope to hear from you. I hope to see your reviews and see you next time.